So my name is Tim Malinowski Jr., and I am a nurse practitioner. So I was born in Cleveland, Ohio. I grew up with a dad who was in the Army and traveled a lot as a family due to that. I've lived in Greenville for quite a while, though, ever since I was in high school, and loved living here ever since then. I got my bachelor's in nursing at the University of South Carolina upstate, and then spent 5.5 years working as a CCU nurse here at Prisma. And from there, went on to Clemson University, where I got my nurse practitioner degree. So after working as a nurse for 5.5 years, I knew that I wanted to take that next step into more of a provider role. I had been working in cardiology, in the CCU, which is the coronary care unit. Got to know the cardiology team, fell in love with everything cardiac, so I knew that when I became a nurse practitioner, I was going to want to end up in cardiology. So I'll be working in the subspecialty of heart failure and pulmonary hypertension within the cardiology specialty, and I just find that area of medicine super interesting. We're taking care of patients with, it's a pretty heavy diagnosis to get diagnosed with heart failure, pulmonary hypertension. But what's cool is there's medical intervention, medical therapies, technological interventions that can really give these patients a nice quality of life given their diagnosis. What I like, the style of practice within the heart failure team, the cardiology team altogether, it's very team-oriented. So if you came to see one of us, you're going to very likely see the nurses, the nurse practitioner, the physician, and we're all going to get to know you really well inside and outside of the hospital or in the practice. So I really love that this group that I'm with has this very team-oriented approach. So I started as a nurse at Prisma Health. I loved my time as a nurse, and I knew that if I'm going to continue on as a nurse practitioner, I want to stay here in Greenville. I want to stay with Prisma. I think we have great people that work at this organization, and just getting to know all the various healthcare providers, team members, I knew there's no other place I wanted to be. Outside of work, I like to travel. I would say my most favorite thing is to go somewhere I've never been, get lost in a culture that I've not experienced. So whenever I'm not at work, I'm usually trying to look up the next trip to somewhere. Advice that I give to patients that hopefully they find valuable is to actually seek out treatments, because a lot of people don't know the treatments that are out there, specifically in cardiology, heart failure, pulmonary hypertension. There are always new treatments out there, always new technologies, mechanical supports, advanced therapies that can really make a patient's quality of life much higher. And all they got to do is reach out to a healthcare provider, and they might be able to discover that. If you'd like to make an appointment with me, you can do so by calling the number on this webpage.